I do think that we can't lose sight of the fact that the core of the healthcare world, particularly in this country, is something incredibly powerful and beautiful and brilliant and innovative, and I mean, it's the gold standard for the world. You know, it's an extraordinary accomplishment. But at the same time, there's something, I think people are right, there's something wrong with the structure of this thing. If we were starting it from scratch, we wouldn't build it this way, right? And I also think that what people are correctly saying when they say there's something wrong with the system is they're acknowledging that it's hard. It's just the hardest of all marketplaces, of necessity, right? It's like, we've got a person here who's got something wrong with them that they can't really define, a person over here whose job it is to fix that, and a person over here whose job it is to pay for it. Like, I mean, it's nuts. It's just like, of course there's going to be conflict, and so I think we have to have a kind of healthy respect for the fact that it's never going to be perfect. Never. Right? And what we can do, though, is kind of decide what we're willing to compromise on and decide what we want to optimize. That's the task ahead of us. And we also need to kind of, I think, have a very, very clear sense of what our values are. Right? That's the part of the conversation that I think we're lagging on. You know, I spent a lot of time recently thinking about trust, and I was looking at these trust scores, because people have been measuring trust in a very detailed way for like 50, 60 years in this country. And you all know this, the trust in institutions was way higher 50, 60, 70 years ago than it is today. Particularly in your world, people had massive trust in their doctors in the 50s, and those numbers are way down now. Even though in the 50s, your doctor couldn't do anything. So, trust is unrelated to performance. People trusted the police in the 50s way more than they do now. The police in the 50s in this country were terrible in every conceivable way. They were unprofessional, they were racist. It was just like uncles hiring nephews. It was like nuts. They threw people in the back of prisons and took them away and people loved the police back then. Now they are well-trained, professional. If something goes wrong, there's a process by which, and people don't like the police anymore. And when your doctor could basically look at you, probe you with a stethoscope, and give you like 1 or 2 available drugs, you loved your doctor. When your doctor can cure you of the most impossibly complex disease, you're like, I don't trust them. It tells you that trust is unrelated to performance. So what is trust about? Trust is about values. It's like, have you explained to me, do we have an agreement on what we're doing here? Do you stand for something that is important to me? That's what this is about. And so the thing that we're not doing, that I think we need to do a better job of in the healthcare world, is explain our values. I care about it. That's why I'm here, that's why you're here. I care about it. You're not just some random customer who comes in and out of the store and is buying socks. Right? Yeah. That's not why I went into medicine. Right? That part of it is, and finding ways to allow practitioners to express that, because they all feel it. Like I said, you wouldn't have gone into medicine if all you wanted to do was flip through. Giving people in the medical world an opportunity to express why they're there, what they care about, the values they stand for. That, to me, is the single most important thing in kind of restoring the health of the system.
That's brilliant. That's so brilliant.